Hey everyone. So the topic of today's discussion is tennis elbow. Now the tennis elbow is something that a lot of people do have. Interestingly enough, it's not specifically related to tennis, but it is has come from an area where a lot of overloading of the elbow, the lateral elbow, can become uncomfortable and sore. Obviously tennis is a big thing, but it generally falls upon people who use their forearm and wrist a lot. Now there's a couple of common misconceptions about tennis elbow, or at least there's a few things that we find clinically that just don't seem to be talked about very much, and they can form a real foundation of the reason why it's there. As people who've had tennis elbow will probably know, is that it can be a really frustrating thing to get rid of. It tends to hang around, or it can hang around for a while, despite doing all the recommended exercises. You're working hard in your rehab. But it can be something that lingers for weeks and potentially months and years for some people. So, but often what we find is there's actually a crucial piece of that puzzle that doesn't get addressed, which allows it to persist. So just as a bit of some information about tennis elbow. So the muscles on the outside of your elbow, your forearm muscles that attach to the outside of your elbow, they attach sort of into and around a bump. It's called your lateral epicondyle. What happens is a change in loading of that area for a number of different reasons can make that become irritated and sore, and you can develop a tendonitis, or a more correct term of like a tendinopathy, which is just a dysfunctional tendon, an overloaded dysfunctional tendon. And a lot of the traditional treatment revolves around eccentric strengthening exercises, where you load the area up and then slowly extend through the range of that, sort of opening that range up to target the tendon itself, to strengthen that tendon. But as I said, the reason why we wanted to post a video on this topic is that there's a lot of information about how to treat tennis elbow. There isn't a lot out there that suggests a strong reason why it happens in the first place. So if you've been watching a lot of these videos, you'll probably notice a common theme. I won't say what it is, but hopefully maybe let us know in the comments below, and we'll have a look and we'll see if anyone can get it right. So the thing that I really wanted to touch on with tennis elbow is a lot of people don't realize that it's potentially a neck issue first. And that's often quite surprising for a lot of people, because your elbow is all the way over here, and the area that connects to your elbow is often down the base of your neck, at the top of your upper back where they meet. There's a few levels there at the base of your neck and the top of your upper back that have the nerves that run down past that area. So there's a nerve called your radial nerve, which comes basically from the base of your neck, comes out through your armpit, runs down the back of your elbow, down the back of your arm to your elbow, and then down through towards your thumb in that area. And what can happen is, if you accrue some dysfunction at the base of your neck, whether that be stiffness, tightness, it doesn't have to be anything nasty like a disc bulge or a nerve root issue or anything like that. But if you have some mechanical dysfunction at the base of your neck, it can act very similar to putting a kink in a hose, or sort of pulling the slack from that nerve as it passes through your elbow. So if you're out there using your arm repetitively, as I said, if you're playing tennis, if you're working at a register and you're constantly gripping and lifting, working at a computer, if you're a bricklayer or a tiler, anything where you're constantly sort of gripping and twisting and moving those muscles, creating a load through your elbow, generally, well, for starters, that is a normal thing to do. You're allowed to use your elbow, but if you took some subtle dysfunction into that activity, that repetitious activity, then it can set you up for a problem. So as I said, trying to get to that sort of lower neck stiffness, that lower neck dysfunction, you may not know it's there, but generally it tends to be. If you can release the shackles, unkink the hose, basically restore normal function and flow to that area, then you can start to give your elbow a chance to disappear, and disappear quickly. So the changes in the tendon, the dysfunction that people feel, the pain associated, the weakness, anything like that, is very real. It can be a very specifically local problem to the side of the elbow, that lateral elbow. But the point I wanted to make is that the reason why that has a chance to be there is often because of some prior or some ongoing hidden or covert neck dysfunction that also needs to be treated
if you're trying to get your elbow to settle down quickly, but also to make sure that when it goes away, it doesn't come back again. So if you've been paying attention through a few of these videos, one simple tool that we use a lot, because it's just so effective, it's just so easy and safe and practical, is just using a ball. So again, this is just a basic lacrosse ball. You're welcome to use a tennis ball, a baseball. You can use the sharp edge of a foam roller, whatever you feel comfortable using that gives you specific access to your dysfunction, use that. But for the purposes of this, just with the ball, like everything else, all we need to do is place the ball at the base of your neck in the middle and then let it roll off to one side. Now, the key for any of these exercises is most people have one side that is stiffer or tighter than the other. So if you have a tennis elbow down this side, it may be stiffer on this side, but your body doesn't really deal too much in lefts or rights, so it could actually be the other side. So the key with this exercise is that you start it in the middle, let it roll off to one side, get a sense of how that feels. Does it feel stiff? Does it feel tight? Does it feel tender? Then come back and move it across to the same spot on the other side and compare the two. So one side should feel a little bit stiffer and tighter. Whether it's more tender or not doesn't matter as much because we're looking for that restrictive dysfunction. So spend more time on the side that feels stiffer. So clinically, what we find with a lot of people is if they have a tennis elbow on this side and we spend a lot of time working on the stiffness on this side, mechanically everything around that tends to function better. So don't just be sort of sucked into where it may feel tender. Try and get a sense of how that ball sinks in. Does it feel tougher? Does it feel stiffer? Does it feel more restricted? Spend more time on that side. So it might take you 30 seconds if you have the ball in your neck and you're lying on the floor or leaning up against the wall, standing or sitting, whatever works best for you. Spend as much time as you can working down from sort of mid shoulder blade area, either side, and then just working your way up as high as you feel that you can find some dysfunction. But most people that tends to be within sort of the bottom half of your neck and the top half of your shoulder blades. That sort of section of your spine being stiff and tight often pulls a lot of the slack out of that nerve or compromises the function of your elbow with sort of a chain reaction of mechanical events. So one of the things that we always advise with any exercise is if you have something specific that annoys your elbow, so if for you it's opening a jar or twisting something or doing something that makes your symptoms become reproduced, do that first. Get a really good sense of how strong your grip feels with a towel or something. Get a couple of markers to understand how you feel before the exercise, because what's really important is that if you then treat your neck and upper back, you want to then retest those same symptoms, those same tests to make sure that you see a genuine difference. Because as I said from the start, it can be quite a different topic of conversation when someone has elbow pain all the way down here and we start treating someone's neck. So it's really important that you don't take my word for it or anyone's word for it. It's really important that you can see and feel that connection for yourself. So what can happen, and this is something that hopefully you'll find, is that as soon as you hit a really specifically relevant part of your neck, you may even feel some symptoms or some of the symptoms that you feel become reproduced, whether you have a bit of an ache to start with, maybe that ache will disappear. If you have some tightness or some soreness in there, maybe that'll be reproduced, so you'll feel that sensation connect between the two spots. Obviously that's really, really powerful because if you feel like it's connected, it's connected. Generally there aren't too many coincidences at all in the body. So it's important that you feel like you've got some confidence that you can free up these areas, whichever side it is, and then you can set this up for success. So again, think of that as the foundational concept of potentially why this can become set up to fail in the first place, but then also that these more central issues potentially need to be treated and addressed so that this has a chance to go away. So please don't be confused. It's not that just by treating this, everything will feel better here. It can for some people who are sort of early on in their rehab or they don't have a very sinister condition. But for a lot of people, what it takes is a whole lot of de-stiffening, this chronically stiff and tight sort of central stiffness,
and then also making sure that you address a lot of the dysfunction that's become apparent through here. So generally there's a bunch of tightness above the elbow, sort of more towards the back where the nerve comes in around those triceps. And then also there's generally a bunch of sort of dysfunctions that comes down through the forearm, potentially through the front there. So when you wiggle those fingers, you'll often see some of the muscles in the forearm activate. Any massage or soft tissue work you can do through both of these areas can help relieve the stress on the elbow. As I said, the traditional eccentric strengthening is basically just grabbing a weight, sort of extending your wrist and then slowly lowering it down. That lowering down, there's a lot of research that suggests that potentially helps sort of reorganize the tendon, strengthen the tendon, and help with pain in the long term. There's a whole bunch of sort of grip strength exercises you can do when you're holding a towel. You know, depending on how much of the towel you have, makes it sort of easier or harder. We can do a lot of repetitions of strengthening the tissue around there and mobilizing the tissue around there. But again, the fundamental concept that seems to be missed a lot, whether it's not something that we're as aware enough as we could be, or whether it's just neglected, is that the neck and the upper back needs to be functioning normally. Otherwise, it's hard for the shackles to come off this long term. So hopefully that isn't a surprise to most people, but if it is, obsess over that neck mobility, the upper back mobility. It's crucial to any sort of upper limb issue, but more specifically tennis elbow, because it can persist. So again, the mobility, the strength are the sort of two foundational concepts to any rehab program. But the third one for most is putting things in a better position. So if we know that upper back and neck becomes stiff, and if you can feel that connection and source that connection to your elbow, we need to keep asking the question, well, why is your neck and upper back becoming stiff in the first place? It's not normal, it's not bad luck. Generally, it's a boring, unsexy explanation. And when we talk with patients, we're often looking at, we want to ask the question, what do you spend the majority of your time doing throughout the day? Or what positions are you putting your neck and upper back in the most throughout the day? It may not be that specifically, but it's a really good place to start, because if it's not that, then it's going to be very likely something close to that. So for a lot of people, what that looks like is looking down. So again, with a lot of these issues, if you're in a nice up tall posture, everything's loaded quite straight. But what we find is if you're using a phone, if you're working at the register, if you're bricklaying, if you're doing something specific, there's often a hinge that we create sort of somewhere in the spine that over time your body has to reinforce that to deal with that position that you're consistently in. But the dysfunction becomes apparent somewhere else. You may not necessarily notice that your neck gets stiff, it may not be sore, you may not feel like your range of motion is heavily affected at all. But when you do use a ball to go hunting through that neck in that area, it's very, very, very likely that you'll find something specific. And as we spoke about in a previous video, where the sharpest point of your curve is, or where the hinge is in your neck, is most likely going to be where your body has had to stiffen up to cope with that. You probably find that relates to the stiffest, the tightest, maybe the most tender part, maybe when you dig the ball in. So if you can relate those concepts together, again, it sounds strange that elbow dysfunction can be caused by sort of bad neck positions, but clinically it's a very real scenario, and it's so real that if you can free up that neck and keep it in a good position, you don't deserve to get elbow problems. Tennis elbow shouldn't exist. So if you are someone who does play tennis and your elbow becomes sore when you play tennis, it's important to take a step back and say, well, how often do you play tennis? Total time playing tennis, maybe 3, 4, 5, 6 hours a week, depending on who you are. But most people can spend, 10 to 14 hours a day sitting in a bad position, depending on work and habits and things like that. So the most obvious things aren't always the true cause of issues. Often it takes you taking a step back and say, well, what positions am I in when I'm doing more interesting things, and sort of working back from that. So
So again, a handy tennis ball, lacrosse ball is a very, very effective tool at combating tennis elbow, but potentially not in the way that you expect. So if you have any questions, please let us know in the comments below. If you have any conditions that you would like explained and some exercises given, again, please let us know. And we'd appreciate sharing this video just so that other people who are going through these issues can have a look for themselves. So until next time, thanks again. See you later.